Hi, I'm Alana Gold, a clinical neuropsychologist at NYU's Child Study Center. And today I'm going to be talking about what is a neuropsychological evaluation as a resource for ADAPT. A neuropsychological evaluation is a comprehensive evaluation of the development of an individual's learning profile and their cognitive strengths and weaknesses, or strengths and weaknesses in different areas of thinking. The goal of an evaluation is to identify underlying processes that could disrupt a child's ability to learn or function in their environment. And how we do this is by using various assessment techniques to gather information about cognitive strengths and weaknesses within the context of that child's development and medical and psychosocial factors. Overall, it helps us to better understand how a child learns, helps clarify why a child may be experiencing learning or behavioral difficulties. It helps us to consider effective teaching methods for that particular child and to figure out a way to use a child's strengths to help overcome their challenges or weaknesses. A neuropsychological evaluation also helps provide appropriate recommendations for educational placement and academic services and accommodations, as well as supports and interventions that can be implemented at home and outside of school. Why may a child be referred for a neuropsychological evaluation? Well, if a child appears to be struggling at school and at home, they may be referred for a neuropsychological evaluation if there is suspicion or they're at risk for a learning disability or cognitive deficit. They also may be referred if there are diagnostic questions, such as, does this child have a developmental disability, a learning disorder, ADHD? They also may be referred if the child is not making progress with the current interventions or teaching methods that they're receiving both in and out of school. And sometimes a child's educational team or treatment team needs more information about how a child thinks and learns and how to help that child make greater progress. How does this information help us? Overall, it really helps us understand why a child is struggling so we can, again, provide better and more appropriate interventions in order to use the child's strengths to overcome weaknesses. Additionally, a lot of times helping the child understand why they're struggling can also help improve how they feel about themselves, their self-concept, and their self-esteem. Understanding a child's cognitive profile can help us provide proper diagnosis and therefore appropriate treatment, interventions, and strategies. Some of the problems typically seen or diagnosed in a neuropsychological evaluation is attention deficit hyperactivity disorder or ADHD, learning disorders such as specific learning disorder with impairment in reading, writing, or math, a language disorder, autism spectrum disorder, and psychiatric disorders like depression and anxiety, to name a few. What do we tell our children when they're going for a neuropsychological evaluation? Typically, what I say or what I instruct parents to tell their child is that we're interested in how they think and how they learn and how their brain works. This doesn't mean there's going to be any shots or we're not going to actually look at your brain, but we're going to be doing a bunch of activities to understand how your brain works, what your strengths are, and what your challenges are, and use this information to help make school better or help make emotions better or whatever it may be that your child is struggling with. So what makes a quality neuropsychological evaluation? I'm going to get to these domains assessed by evaluation in a minute, but really it's more than just testing. A quality neuropsychological evaluation is thorough and comprehensive and should start with information gathering through an interview with parents, interview with a child, and collateral contact with teachers, treatment providers like therapists, speech language providers, psychiatrists, other outside providers like tutors, review of records like report cards, previous evaluations, or individualized education programs or IEPs, and sometimes a school observation might be necessary. Additionally, I'm going to be discussing some of the tests or assessments your child may be given, but there's really no one size fits all, meaning depending on the neuropsychologist, you may receive slightly different tests or assessments, but in most cases, at least a screen of each of these domains seen here should be included. But there are many factors that are considered in selecting specific tests, so I won't focus on what specific tests should be given, because that can depend on a child's age and level of functioning. So I may choose a different test if an individual is 5 versus 18. I may choose a different test based on their level of functioning. So a child who has minimal language may get a different test than a child who's very verbal. It also may depend on what testing has already been done. So if your child recently underwent a psychoeducational evaluation, I'm going to select different measures than the school has given. Now let's talk about the main domains that should be assessed in a quality neuropsychological evaluation. Most neuropsychological evaluations will start with an assessment of intellectual functioning, intelligence, or IQ. We know that many different things make up IQ, but really overall what it looks at is an individual's ability to problem solve both verbally and non-verbally, and how proficient a child is in using those skills. Language should also be assessed. And again, there are different aspects of language. So an individual's receptive language or ability to understand language should be looked at, as well as an individual's expressive language or ability to communicate and express themselves. Additionally, memory and learning is another domain we assess. This includes encoding of information. So if I tell you or show you information, how are you at kind of encoding it in your mind or holding it in your mind and storing it for later? And once it's stored, how do you retrieve or recall that information? It's important to look both verbally and visually at memory and learning, because we know a child could have strengths in one area but challenges in another depending on their profile. Attentions and executive functioning is another important domain assessed. And this really can play a part into all of the domains and all of the evaluation, because we know attention really can underlie performance in general. What executive functioning is really our ability to manage goal-directed behavior. So higher order cognitive skills such as inhibition or impulse control, planning and organization, abstract problem solving and flexibility, time management, and these are all higher order cognitive processes that help us to manage goal-directed behavior. Additionally, we may look at brief attention, as well as shifting attention or switching attention and sustaining attention over time. The next domain is visual spatial skills, which includes perceptual reasoning and spatial knowledge, motor coordination or fine motor skills, things like drawing, fine motor dexterity. Many neuropsychological evaluations will also include assessment of academic skills such as reading, writing, and math. And again, there are many different areas of reading, writing, and math that can be explored, as well as kind of cognitive underpinnings of these skills. So for example, if a child is struggling with reading, I may look at word reading, at decoding new words or nonsense words, at reading comprehension and fluency. And I may also look at some of the cognitive underpinnings of reading, such as rapid naming of letters and digits, or phonological processing, the ability to break down words into sounds. Additionally, a quality neuropsychological evaluation will include assessment of social emotional functioning and adaptive functioning. So that may include daily living skills, clinical symptoms of anxiety, depression, emotional kind of understanding and regulation, an individual's understanding of interpersonal relationships, social perception, and social skills. Really, deficits in any of these mentioned areas can disrupt a child's ability to learn or function properly in their environment. And really, integration of this information is key to a neuropsychological evaluation. So although we assess many areas and get data from all those assessments, we also have to integrate qualitative observations throughout the evaluation because numbers don't tell the whole story. A neuropsychological evaluation and report should provide a cohesive picture of the child's functioning by integrating the data across the domains tested, across sources, those collateral sources I spoke of earlier, what parents had to say, what teachers had to say, and also the examiner's observations. It's also important that the relationship between challenges or any diagnoses made are made with the functional outcomes and how this affects the child and why these difficulties or diagnoses are leading to a child's struggles in the school or home setting. An important part of the neuropsychological evaluation are tailored recommendations for your child, and recommendations really should be individualized. Some recommendations are more or less universally helpful for certain types of problems, but really they should be tailored to the individual's strengths, weaknesses, and experiences and settings. Let's talk about some of the common recommendations provided or types of recommendations provided. A neuropsychological evaluation helps to make recommendations about educational placement, such as type of educational setting, type of instruction or classroom, what related services the child should be getting, such as speech language therapy, occupational therapy, counseling, and what accommodations should be afforded to that student. Classroom accommodations, testing accommodations, or maybe assistive technology. Outside of school, recommendations to help guide treatment planning should also be provided. So that may be psychotherapy referrals or psychiatry referrals, goals to target in treatment, referrals for further evaluation in particular areas of specialization, maybe a speech language therapy evaluation and assistive technology evaluation, and should also provide resources for parents. So in light of COVID-19, there are some recommendations that are currently being made that maybe we haven't thought of in the past, both at school and at home. For children with IEPs who need significant support, efforts really should be made to provide direct instruction to that student that allows them to engage with teachers and other students while minimizing the demands on self-directed or independent learning. So a child with an IEP likely will struggle if they're just assigned to watch a recorded video or hand in a set number of assignments by the end of the day, and really should be provided with more direct instruction and engagement. Additionally, in the virtual learning setting, daily morning and midday check-ins from a teacher or advisor in order to help them prepare for and structure their school day may be appropriate. Some students may benefit from being allowed to record a classroom lesson in addition to being provided a copy of the class notes. And even in the virtual setting, some students would benefit from movement breaks, where should be allowed to turn their camera off for short movement breaks for 3 to 5 minutes at a time. And at home, it's important to help establish a daily routine, especially in light of virtual schooling. So for example, a family could schedule times for schoolwork, short breaks, meal times, and keep those consistent throughout the week, much like a school day. Also, having a designated area in the home for remote learning activities can be beneficial to create a workspace that's free from distractions and follows the same setup as a classroom as much as possible. So quiet room, a desk as opposed to a bed. Many children also benefit from strategies to help with time management, like using an alarm or a timer throughout the day for both their work and breaks. Also, during remote learning, it's helpful for children to have a designated place to keep their phone away from their learning area so that the phone does not distract them. And again, short breaks for the phone can be established ahead of time. So I've discussed many of the recommendations that might be made. And another important part of a quality neuropsychological evaluation is sharing this information, which will include verbal feedback with the family, the ability to really break down findings and answer questions, a comprehensive written report, and consultation with the school and other providers. Here are some resources for you to learn more about clinical neuropsychology and neuropsychological evaluations, as well as special education services. I hope this presentation has helped you learn more about neuropsychological evaluations. Thank you.